Network. Today we will be talking about health system in Canada. So I have Angel Castro. He's a doctor, and he will be talking with us about so many topics related to the health system in Canada. So newcomers, get ready. Hi, Angel. How are you?
Hi, I'm good. Thank you for having me.
I'm so happy that you accepted my invitation to come to this episode. This is a program for newcomers. Well, it's for everybody, but usually we discuss about newcomer issues and for newcomers to learn more about living in Canada. So,
I'm thrilled to be here.
just to start, tell us a little bit about your profession, about what you're doing here in Manitoba.
Sure. So I'll start from the beginning. I came from Manitoba when I was a teenager. I went to university, started my Bachelor of Psychology. I did a little bit of physiotherapy, and then decided that medicine was for me. So I went into medicine, did 4 years of that, graduated in 2018, and I'm right now doing my residency in family medicine. So I'm 7 months away from finally finishing this long journey and being able to practice independently.
Wow, congratulations.
Thank you.
Congratulations.
Thank you.
And you know, something that I find interesting of this conversation with you is that you have the experience from back home, but you also have the one from here, and you can compare, and you have the opportunity to share and to see patients from all over the world who say their opinions about the health system in here. We would like to start with the things you think are very important to know. What do you think newcomers should know before they come to Canada or when they are just arriving here during the first years?
Of course. So I'll start off by saying that a lot of the experience that I have and the point of view is mainly from Latin America and how it compares to Canada. But I'm sure that a lot of the systems and how the systems are in Latin America can be generalized to other parts of the world. And what I find is that a lot of the people that come here to Canada, they come here with the understanding that, the expectations of what good health care means, but they not necessarily understand that there's key differences that characterize the system in Canada that sometimes lend itself for some disappointment and, getting a little lost into how to navigate the health system here in Canada. There's two main differences that are here in Canada. Number one is that who pays, and in here, as you know, it's a public system, so the government pays through our taxes, so that is a key factor. And then the other thing is how little doctors there are here in Canada. Like when you compare it to other places, like in Latin America, there's, just in Mexico alone, there's 165 schools of medicine, and in here there's only 17 in Canada right now. So there's a big gap in need of practitioners. So when you combine those two things, it creates a context in which a lot of people really don't know how it works here.
That's important to know. And I don't want to ask you why, because this is not your topic. This is the government issue. But it's important to know because, for example, finding a family doctor.
Yeah, that's a common question that I usually get. And it's something that a lot of people that come here don't understand the importance of having a family doctor. I'll give you an example. In other countries, one has the freedom and the choice to directly access a specialist of their choice. For example, if someone wants to see a cardiologist, they go, they make a visit, and they pay, and they get the opinion of the cardiologist. In here, that's not how it works. Usually, to access consultants or specialists, it has to be through a family doctor, most of the time. And so that's the first thing that people need to understand, and the key to navigating the system here properly. First thing you need to do when you get here to Canada is to get a family doctor. Number one, most important thing, because through your family doctor, you'll be able to access all the different services. If you need blood work, you'll get it through your family doctor. And it helps to build your medical history in a centralized way where you're able to, receive the care that you need. And so that's the first thing I tell people. Where you can find it is, there's three ways you can do it. Number one is you can just go to websites Each country, or I should say each province, it has a website that is kind of the equivalent of a doctor finder, in where you key in your all your demographics and your preferences, and it matches you to a family doctor. The second way is simply just go to any clinic or call and just ask, do you have any doctors that are accepting patients? And they'll either say yes or no. Just basically, it's like job hunting. You have to. That's basically what it is.
And something that is very confusing at the beginning is finding the differences of family doctor, walk-in clinic, and emergency. I would like you to explain me, please, because I'm still a little bit confused. I have my family doctor, but I'm still a little bit confused with the three. When should I go to a walk-in clinic, or when should I go to an emergency? If I have a family doctor, if I don't have, either ways.
Of course, that's an excellent question. So your family doctor is your doctor that takes care of you as a whole. It's a doctor when you want to, when you have chronic conditions, when you want to get your yearly physicals or periodic health visits, when you want to adjust your long-term medications, you make your appointment with your family doctor. Sometimes, you have to wait a few weeks, but it's all right because these are usually non-urgent issues that you can wait for that. So that's when you go for your family doctor. Walk-in clinics are usually reserved for when you need to see a doctor for a non-urgent issue, like a cold, a cough, some pain, or you need a medication for X or Y problem. They're a great place to go, walk-in clinics. It's important, and I always tell patients or people to identify some walk-in clinics around your area so that, if one you go and it's busy, you can go to the other one. Walk-in clinics tend to be only for one problem. It's not usually the right place to go when you have several issues that require follow-up care. If you have several issues with requiring follow-up care, a family doctor is the place to go. Then, if you need to be seen for a problem that is urgent, that is, like you fractured yourself, you need to see the doctor, and you need higher level of equipment like x-rays or maybe a little bit more blood work, or it's an urgency, then you can go to urgent care or emergency. Like here in the city, you can go to urgent cares are Seven Oaks Hospital, Concordia is an urgent care. And emergency rooms or emergency departments are usually reserved for emergencies. Emergencies defined as conditions that will kill you or, put in danger your life or any limb in the matter of minutes to hours. So that's when you go to the emergency room, because they have all the equipments, they have all the consultants, all the specialists, and all the big toys to help you right there and there. And so knowing where to go, depending on what your problem is super important. And especially for newcomers.
Wow.
Because the story that I hear often is that people come here and they have a non-urgent problem. Let's say it's important, but non-urgent, like an infection, and they go to the emergency room. And in the emergency room, there's dozens and dozens of people. And usually you're triaged based on how emergent it is. And if you are there and you go with a non-urgent issue, you're going to be waiting there for 12, 14 hours.
What is an urgent issue?
Well, that's what we talked about. Like an urgent issue is usually something that you need to be seen by a doctor within the same day. An infection, a serious infection, a fracture, things like that. And so a lot of people that I find they're going with a pain, which is, they need to be seen, but maybe the emergency room is not the place where you're going to be seen the fastest. When you have something that you need to see a doctor and you want to see them today, but it's not emergent or urgent, a walk-in clinic is the right place to go. Here in the city, there's a variation of that where there's some clinics where you can call and book ahead of time and make an appointment. It's called the same day or next day appointments. I can think of Calo Clinic does that. You can call in and make an appointment for the next day or two. So it's kind of like a hybrid of a walk-in when you make an appointment. And there's the other one that I can think of as a minor illness and injury clinic in Corridor. So a lot of information. And as a newcomer, it's important that you familiarize yourself with the area and you know where to go for a given problem. So that number one is you receive the care that you need and you don't wait as much as you otherwise would. That's the thing.
You know, something that caught my attention, because it works different in my country. When you go to a walk-in clinic or a family doctor, the system is connected. Like the walk-in clinic, they have my information, but in my country it does not work the same.
Right. So here, because this is a centralized system, basically your information, which includes all of your blood work, your imaging, CT scans, x-rays, is collected in a system called eChart. And that can be accessed anywhere at most places of the province. So if you go to your family doctor and they have access in their clinic to eChart, they will be able to see the blood work that they did in another hospital. And vice versa. If you go to the hospital, they can see all the blood work, all the imaging that you've received, I think in the last 10 years.
Yeah. I would like to share with you guys something interesting. In my country, when you go to the doctor and you take all the blood tests or any kind of exams, you go to another doctor, the doctor requests the same so you have to do it twice because they don't trust to the other ones. And it's something that I really like it from here.
Yeah, it has, that's one of the advantages of that it's a centralized system where most of your information can be stored there. Whereas in other countries like, in the South, you have to carry your information and you decide where to go. You go to the cardiologist, you go to the dermatologist, you go to the gastroenterologist. And in here, you have your family doctor that communicates with all of them so that there's one person that you can talk to. So that's a nice thing about having a family doctor.
And what happened when with pregnancy and the babies? How does that work?
Yeah, so that's a little bit different. So there are most specialties are accessed through after you being referred from another doctor. But there are some specialists that are also involved in primary care. Obstetrics is one example. Like it depends on where you are and depends a little bit on the doctor, but some doctors will take you, let's say when you're 20 weeks pregnant or even earlier, you can just go straight to the specialist and you don't need a referral to be seen, at least here in Manitoba. And the same thing about pediatricians. So they're specialists, but they are also involved in primary care. Now, the reality is that there's very little pediatricians. And so a lot of the care provided to young fellows is done by the family
doctor.
And they're referred to specialists, pediatricians, if there is a more serious chronic condition.
Wow.
Yeah, that's how it's supposed to work in theory. Yeah.
These are some of the challenges.
They are indeed. There's a big shortage.
When you compare both systems, which are those things that you say, oh, I prefer Canada?
I think not having to pay out of pocket is very nice. There's a lot of challenges from, knowing where to go and accessing the system. But once you're in the care of a family doctor, once you're in the care of a tertiary care, you're in hospital, nothing comes out of your wallet.
Yeah.
And that is huge. Like, I know that let's use an example, pregnancy. I like obstetrics. A patient can become pregnant, be followed throughout all the investigations, all the imaging, deliver in a hospital, and then go home without paying a dime. The same thing will cost you a few $1,000s anywhere else. And so that for me, it's one of the things that it's really, it's a big pro.
And what about the private insurance, like health insurance? How does that work? When do you need a private insurance?
It depends what kind of private insurance we're talking about. So what we've talked thus far is about accessing medical doctors. It's not really talking about the health system as a whole, because if you think about health, it includes a lot of the allied health professionals that are vital to the system, like occupational therapists, physiotherapists, dentists, And And here in Canada, if you have a private insurance through your work, Canada Life, Blue Cross, etc., it can provide you some coverage depending on the plan so that they cover up to like 80% of those visits. That's the kind of private that most people here in Canada are familiar with. There's this other kind of private insurance that for people that come from other countries, that for X or Y reason, they require to see a doctor. Those people will have to, depending on where they are, if it's a clinic, they will have to pay out of pocket. If they go to the hospital, they will receive a bill afterwards. And depending on how the private insurance work from their country, they'll either reimburse part of it, or it depends on that. It depends on the insurance of the country it was issued.
Some services are not provided by the public, by the government health system.
For the most part, unfortunately.
Now, we know there's not that many doctors. Do you find any other areas of improvement other than the shortage of doctors?
Yeah, well, I mean, that's a big one, the shortage of doctors, because it means that, think about that. That in itself is a huge one, because it means that you can't access a family doctor. You have to wait a long time. When you're referred, you'll have to wait even longer some people are waiting to get their knee replaced for 2 years. It's a long time. And then when they're seen, because there's so many patients to be seen by one specific doctor, they feel like you're rushed,
I was going to ask you about that.
Yeah, so it's a big one. Yeah, it was like, okay, you good? No, you're not dying? Go. It's not like that. I like to be facetious. I like to joke around that, but it's most of the time, it feels like that, but it really isn't. And I think that's because of some communication issues.
It's that rule that you need to see this amount of patients in a day.
Not really. Every doctor works different. Some doctors, work as employees, but most doctors work on what is called a fee-for-service. So they basically get paid for each visit. And depending on how busy they are, they can see anywhere from 12 to 40 patients a day.
Wow.
So that, when you have 20 people waiting in your waiting area, you have that incentive to be more efficient. And sometimes, unfortunately, that can, the first thing that goes is the time to communicate and explain what's happening. A common example, people are worried about their pain. The most common worry is they think they have cancer, right? It's true. Even WebMD tells you that, like, oh, it's cancer. It can always be cancer. And you tell your doctor your problems, and your doctor, obviously he or she, or they think about that, but they're not worried about it, but they may not have the time to explain you why. So in their mind, they're like, okay, there's little chance there's cancer, you can go. But in your mind, you're like, you're still worried about it because you feel like there was not that communication or that encounter that reassured you. So I find that when I talk to patients, I just sometimes this is what I do. I take an extra seconds to think out loud. And that helps the patient to see that I'm thinking about their worries. So I just straight up ask him, what are you worried about? Cancer. I don't think it's cancer because this, and that. And they're like, okay.
So that person is mentally prepared that it's okay.
Every patient wants something from that encounter. It's not always a medication. Sometimes it's just an explanation. So that's, I think, something where, because everyone's so rushed, patients don't get that. And when you add on top of that, English as a second language and culture differences, it can feel like you really rushed. So there's that other dimension that adds to this feeling of, feeling perceived inadequate care that patients receive.
Wow.
Yeah.
I didn't think about that. And talking about multicultural patients, how does that work when you're having patients from cultures that are totally different? And how do they see the health system? Because this is something I hear from friends and colleagues from different parts of the world. I'm not just talking about the Latino community, newcomer community in general. they they complain.
Yeah. And you know what? There's always room for improvement. I think, that's a very broad topic of discussion, but I've had the luxury, the pleasure, and the privilege of seeing patients from all over the world. And, they have their opinions, they have their backgrounds, they have their history, they have their previous encounters with the health system in their country. So they come with that similar expectation that they're going to receive that here. So a lot of it is just education. It's just explaining how things work. It's taking the time. And unfortunately, there isn't a lot of that here. There's some very good work done in the immigrant and refugee clinic that is in Elgin Avenue that does take the time to take refugees and immigrants to explain them and orient them to the system. But other than that, there's not enough resources to explain how it works here. There's a website, and that's actually one of the reasons why I started my YouTube channel, to provide explanations about how the system works in Spanish.
Anyway, just for the Spanish speaking. So, would you like to share your YouTube community channel?
It's Médico en Canadá. In Spanish, like medic in Canada. Yeah. So.
Any recommendation, Angel, for newcomers, something that we didn't mention before, or for example, because many people are watching this video from their countries because they're planning to come to Canada. So do you have any recommendation for those people?
It's more of what we've already discussed. Just like you take the time to research, everything about life in Canada, take the time to familiarize yourself with the health system. When you get here, make it a priority to find a family doctor. Even though you're healthy, even though you're strong and you're not sick, finding a family doctor can take months, if not years. So make sure you make that a priority. Find a family doctor. That's the main thing I would say. And take care of yourself. We are just human beings. Doctors are human beings. It's not on us. What's going to influence the most in your health? It's going to be your habits, your lifestyle. So stay healthy. Coming here is a big shock. As I know, coming here is a tremendous shock that can, cause some mental health challenges. There's a change in the culture shock, the weather. So it's important to take care of yourself. The basic, simple, but effective ways of staying healthy. Good exercise, vitamin D, especially when it's already dark outside, physical activity, staying connected to loved ones. All the small things that actually add up and does make an impact in your health. That's the main thing, I think.
Now, Angel, that you're talking about taking care of ourselves, what can you tell us about preventive medicine in here?
I will tell you that I think preventative medicine involves lifestyle modification, like we discussed. And this is my personal view. May not reflect the view of the general community at large, but I am of the mentality of keeping a few pillars, maintaining 5 pillars. Number 1 is minimize alcohol. I know it's hard. Minimize smoking, and treat sugar as a drug. That's my personal belief, because I think sugar, sugar, I see it as sweet poison, and I think limiting sugar has tremendous effect in both health and mental well-being. So I think those are the things, the main ones. Of course, getting your 150 minutes a week of physical activity, taking vitamin D in the winter, and staying connected.
Something that I found different also when I came here, it's that you go to the doctor every year, for example, back home, and you do certain, you might say, test or screening, how you call that?
Yeah, if you're talking about your checkups, those are periodic health visits.
Yeah, but there are specific ones. For example, for the women, the Baptist.
Yes.
And here I was surprised. Every 3 years. back in my country, I think every 6 months or 8 months. So it was shocking for me.
That's actually a very common question and concern that I hear from newcomers. They come here with the expectation, like I said previously, that the system here works the same as back home. And I hear all the time, back home, I would get a whole physical, I would get a battery of tests. For men, they'll get their prostate checked. For women, they'll get their pap smear yearly, 6 months, like you say. And in here, they don't even do it as frequently. I can't speak to why they do it that frequently in other places, but I hear we basically guide the screening. And this is a general principle that I think it's important or worth exploring. The screening for, let's say, cancer, if we're talking pap smear for females, or the PSA in prostate for men, or colonoscopies, or all of those screenings. It's often thought that if you do them more frequently, you will catch a potential malignancy beforehand, and you are going to be able to treat it and survive.
That's why I'm asking you about the preventive.
That's the idea. But there has been a bunch of studies. There's actually task forces that it is their mission to determine what are the benefits and the harms of screening. I'll give you an example. Let's use the PSA, which is the prostate screening for prostate cancer in men. In here, doing a yearly prostate, a PSA level in the blood, has it harms as well.
In the blood?
In doing it, I'll tell you an example. If there's an elevation of this level, it could be cancer, but it could also not be cancer. And so what we do when there's an elevation, we might go in and do a more invasive procedure. We refer to a urologist, and they will go in and do what is called a cystoscopy, and they will take a biopsy, and that means taking a tissue out of it. And that, many times, it just turns out to be a benign condition, right? But going in and taking a biopsy can create very real problems like incontinence, pain, and things that can actually really impact the life of people. So my point is that screening does have harms. And when we decide how frequently we do them, we use the task force guidelines that take into account the harms and the benefits. Specifically for prostate screening, you have to do 1,000 of those screenings in 1,000 people to save one life. But you can harm around 200 people from doing it. So that's the thing that people don't usually talk about. People have this bias to, when I say people, I mean a lot of patients that come in wanting yearly screening or very frequent screening. They think that they're going to prevent cancer, but the reality is that you can do more harm than good if we just automatically screen for this condition.
Wow.
Now, I want to be clear. Screening means that there's no symptoms. It means that you're fine, you don't have any symptoms, it's fine. If you're having any symptoms, that's not screening anymore. That is an investigation. That's a different issue. Does that make sense?
Of course. Wow. So, Angel, thank you so much for coming with us. I hope you come back soon and continue talking about this important topic, because this is something that all of us struggle with and understanding about it. So thank you to our wonderful audience for having us in another episode, and see you the next time. Don't forget to follow us in our social media. Bye-bye.